Hi everyone, today's topic is one that is often misunderstood and overlooked, the co-occurrence of autism and ADHD. The diagnostic criteria for both conditions overlap and intersect in significant ways, leading to frequent confusion and misdiagnosis. The rate of comorbidity between autism and ADHD is significant. Some estimates suggest that as many as 60 to 80% of individuals with autism also have ADHD. And a similar proportion of individuals with ADHD have symptoms of autism. However, it's important to note that the exact rate of comorbidity may vary depending on the population being studied and the methods used to assess the conditions. For a long time, the prevailing view in the psychiatric community was that individuals with autism could not also have ADHD and vice versa. This was a simplification of the complex reality of the conditions and was not supported by the available evidence. However, more recent research has challenged this view and shown that the two conditions can co-occur. Here are a few examples of the symptoms that are often confused between both. 1. Hyperactivity. One of the hallmark symptoms of ADHD is hyperactivity, which can lead to fidgeting, restlessness, and difficulty sitting still. However, some individuals with autism may also exhibit hyperactivity or increased energy levels, which can be mistaken for ADHD. Our second one is inattention. Another key symptom of ADHD is inattention, which can manifest as difficulty focusing or staying on task, forgetfulness, and being easily distracted. Similarly, individuals with autism may have difficulty sustaining attention or may exhibit tunnel vision when it comes to their interests or obsessions. Our third symptom is social communication. Both autism and ADHD can affect social communication, leading to misunderstandings and difficulties in social situations. However, the specific nature of these challenges may differ. For example, individuals with autism may have difficulty with nonverbal cues or understanding social norms, while those with ADHD may struggle with impulsivity or interrupting others. And our fourth and last example, we have sensory processing. Both autism and ADHD can involve sensory processing challenges such as hypersensitivity or hyposensitivity to certain stimuli. However, the specific types of sensory issues and the way they manifest may be different, which can lead to confusion when trying to distinguish between the two conditions. The importance of an accurate diagnosis cannot be overstated. In some cases, the symptoms of autism and ADHD can exacerbate each other, making it important to accurately diagnose and treat both conditions if present. This not only benefits the individual, but also contributes to the well-being of the community as a whole. So you might ask, what does the diagnosis process look like for autism and ADHD? When seeking a professional diagnosis, it's important to provide a thorough history of your symptoms and any relevant medical or family history. It may also be helpful to bring a list of questions or concerns to discuss with your doctor. Some questions consider asking include: how will the diagnosis process work and what steps will be involved? What specific tests or assessments will be used to diagnose autism and or ADHD? How is the doctor trained and experienced in diagnosing these conditions? How will the doctor consider and account for the overlap in symptoms between autism and ADHD? What potential risks or limitations are associated with seeking a diagnosis? It's also important to find a doctor or specialist who is knowledgeable and experienced in diagnosing both autism and ADHD, and who can provide an individualized, comprehensive evaluation. This can help ensure an accurate diagnosis and avoid the risk of misdiagnosis or missed diagnosis. In conclusion, the co-occurrence of autism and ADHD is a complex and often misunderstood topic, deserving of serious consideration and attention. Accurate diagnosis is essential for effective treatment and management, and seeking out a knowledgeable and experienced professional is the first step in this process. Remember, taking control of your health and well-being is the foundation upon which you can build a fulfilling and meaningful life. Thanks for joining me today. I hope this information was helpful. If you have any further questions or concerns, feel free to reach out in the comments below. And don't forget to like, share, and subscribe for more content like this.